live. Let's see how is our live version here. Yeah, we're live here, and this is how we look. There's a lagging, something like 10 seconds, but this is how it looks, and we're live. Let's just double check the sound.
If you want to be more in it, you're welcome to sit closer.
It's okay. I think this space is okay for me.
And we're live. Okay, it looks like everything's working, but there is a lagging. Okay. Thank you for coming. And sorry
Thanks for organizing.
Oh, you're most welcome. And we are 5 minutes behind. 7 minutes, but that's okay. This is the first time. So, and just a couple of housekeeping items. This is Facebook Live, and if you want to be seen, you can sit down here, and if you want to be masked, you can sit down here. And the washrooms are outside the office, and the keys are here. So if you need the washroom, just let me know.
Okay.
And this is the monitor screen. So this is how we are presenting it on Facebook.
Okay.
And there's a slight lagging, something like 10 seconds. If you need Wi-Fi, it's here. And the agenda is I present for something like 15 minutes. It's a briefing of this article, and then we discuss for 45 minutes. And then we have the sponsor presentation, because Sherry is our sponsor and she has provided the facility and everything for us. So she will talk about her amazing offers. And then we come back together again and talk about 30 minutes again about the article. Okay? So let's start the presentation.
Yeah, sure.
And you see the PDF here. Let me make it larger. Can you see, Sherry?
I can see it. Oh, it's difficult.
Yes.
Okay.
Yes.
Okay.
Just let me turn it off, because otherwise the voice would be, it's off. Okay.
Yeah.
So we will talk about the evidence-based hypnotherapy journal club. We are here every month to talk about the evidences in hypnotherapy, and we look how supported the hypnotherapy is in terms of evidences. The first session is about chronic pain. And I'm Reza Mustafavi from Hypnosis and Hypnodontics Canada. And Sherry is our sponsor from Luxury Corporate Cruises. And the article we want to discuss today is Hypnotherapy for Management of Chronic Pain. And the authors are Gary Elkins and Mark Jensen and David Patterson, who are in medical school of Washington University Medical School in Seattle. So they are 2 hours away from us in Vancouver. And background. What's the definition of chronic pain? Any pain which is persistent for more than 6 months is referred as chronic pain.
Yeah.
This is the definition of chronic pain. And these are some statistics about the status of chronic pain in United States. 11% to 45% of individuals in the United States experience chronic pain. And 75% of patients with advanced cancer experience chronic pain. And chronic pain is the most common reason for the use of alternative medicine. So the article talks about the application of hypnosis in different conditions and different chronic pains. The first one is cancer patients. This study is conducted by Spiegel and Bloom in 1983, and 54 women with chronic cancer pain were allocated in 2 groups. The standard care group, 24 women, and the other group, 30 patients were receiving expressive supportive group, including hypnotherapy. Hypnotherapy was not the main focus of this, but it was shown that the hypnotherapy group was responding to treatment was responding very dramatically. Patients who were receiving hypnosis, in addition to group therapy, reported less increase in pain over time as cancer progressed compared to patients who did not receive the hypnosis intervention. And as you see, the p-value is less than 0.05. And what does p mean? Is p, in clinical trials, the routine is like that. They assume a null hypothesis, and the null hypothesis is there is no difference between two groups. And then they try to exclude this null hypothesis. And p-value is representing the probability of the accuracy of null hypothesis. So in simple terms, p shows that first of all, the smaller the p is, the higher the level of evidence is.
Yeah.
So most of the times we assume p-values which are less than 0.05, an acceptable one, but the lesser the p-value is, the higher the level of evidence is, because it shows in simple terms shows how coincidentally these associations are shown. But we don't have to make a mistake in terms of association between cause and effect, because p-value is reflecting the level of evidence. It's not showing the level of association between cause and effect.
Yeah.
I see.
The other study about cancer pain was conducted by Elkins and their group in 2004, and 39 advanced stage cancer patients with malignant bone disease were allocated in two groups, and one group were receiving hypnosis intervention, and the other group were receiving weekly sessions of supportive attention. And the hypnosis intervention demonstrated an overall decrease in pain for all sessions combined, and as you see, the p-value is really low, which means the level of evidence is really high. It's 0.0001. And low back pain is another indication. We don't talk a lot about this. Arthritis pain. Sickle cell disease. Sickle cell anemia is a metabolic disease, and it's a hereditary disease, and the hemoglobin synthesis is impaired. So as you see, instead of the oval shape of red blood cells, there is like crescent blood cells, and it causes some vaso-occlusive pains, or the vessels are blocked, so there are pains in sickle cell disease. And Deans and his group were investigating sickle cell anemia and sickle cell pain in 37 adults and children patients, and as you see, the number of pain days were decreased in hypnosis groups. However, there was no decrease in the number of days of pain days where the medication was taken, but the pain was still persisting, or the percentage of bad sleep nights. They were not affected, but the number of pain days were decreased. Temporomandibular pain. As you may know, temporomandibular pain is caused by two main causes. One main cause is the temporomandibular joint, the joint between the mandible bone and the temporal bone, or the temporal part of the skull bone. And the other cause of temporomandibular pain is the masticator muscles, or the masticatory musculature. Simon and Lewis investigated the temporomandibular pain disorder in 28 patients, and there was a significant decrease in pain frequency, pain duration, and there was an increase in daily functioning. And the result was maintained at least for 6 months after treatment.
Wow.
There was another study, and they were allocated the sample group, 40 female patients, in 3 groups. A, they applied hypnosis as hypnorelaxation. The other one, they used an occlusal appliance. It was like a night guard, but something external on mandible to fix the temporomandibular joint, to support the temporomandibular joint. And the third group was just education and advice. And then they compared these three groups, and they realized that the hypnorelaxation and occlusal appliance were effective than education. However, only patients in the hypnosis condition and not the occlusal appliance group reported significantly greater decrease in pain intensity. So hypnosis was superior to occlusal appliance, and occlusal appliance and hypnosis were both superior to education. Fibromyalgia. Fibromyalgia is more common in women, and it's like unexplained pain in muscles and joints. The nature of the disease is not destructive, so there is no joint deformity, there is no muscle deterioration, but it's really debilitating because the pain is really severe in some cases. Nobody knows the underlying pathology, but there are some theories in favor of the fact that maybe people who are experiencing fibromyalgia have a lower threshold of pain. And Hanen, in 1991, they investigated 40 patients with fibromyalgia, and they divided the sample group in two groups. One group was receiving hypnotherapy, and the other group was receiving physiotherapy. So it was a neck-to-neck comparison, and the patients who were receiving hypnosis showed significantly better outcomes on measures of muscle pain, fatigue, sleep disturbances, stress, and over physiotherapy. So it's really interesting that, because a lot of people are referring to physiotherapists for fibromyalgia, but evidence-based medicine shows that hypnosis is superior to physiotherapy when it comes to fibromyalgia. Disability-related pain. And Jensen, in 2005, Mark Jensen showed that the pain intensity, pain unpleasantness, and perceived control over pain was seen in the hypnosis group. However, in disability-related pain, the depressive component of pain was not decreased in hypnosis group. So hypnosis, it shows that in disability pain, hypnosis can decrease the pain intensity, pain unpleasantness, and perceived control over pain, but not the depressive component of pain. And the interesting thing about this study is they realized that hypnotizability, or the degree of hypnotizability, was not important, and it was not associated with better outcome. And it makes sense to me because in most therapeutic modalities, there is no need for a deep trance. A moderate level of hypnosis is more than enough to apply the therapeutic approach. That's why the hypnotizability is not really related to the outcome. A very low level of hypnotizability is more than enough for therapeutic approach. Mixed chronic pain and discussion. In this review article, 13 published controlled articles were evaluated for chronic pain, and except 2 of them, the rest of them were controlled clinical trials, so they were randomized, and they were a control group and a hypnosis group, and they were compared to each other. And in each of the studies, the hypnosis intervention was shown to be significantly more effective than a non-treatment condition. And the efficacy of hypnosis was consistently confirmed in a wide variety or a wide range of conditions, chronic pain conditions like cancer, low back pain, arthritis, sickle cell anemia, temporomandibular pain, disability-related pain, etc. There was an interesting, puzzling article about CBT or cognitive behavioral therapy and hypnosis. I didn't include that in the presentation, but if you are interested, we can talk about that article later in discussion part. But I didn't include that for some reason in this presentation. And the limitations of the study. First of all, the number of samples were small, so it was very hard for some conditions, for some chronic pain conditions to find a study. Some chronic pain conditions had just only one study. So the number of studies and the number of cases were limited. And there was no standardization. So they talked about self-hypnosis and hypnosis, but they didn't use the same method and the same standard to apply that. One of the most discrepancies was seen in self-hypnosis, because some people were using like radio taping, tape recording, and some people were using live sessions. So there was no consistency in terms of providing the hypnosis or self-hypnosis sessions.
Oh, okay.
That was one of the limitations of this study. Lack of standardization in hypnotic induction. And in terms of standardization, they offered something at the end. And to be honest, when I used to use hypnosis for chronic pain, I was like different in each situation. But after reading this article, I decided to stick this standard. And I just read the standard they are offering. They say they offer these items for a standard hypnosis session for chronic pain. A standard hypnotic induction that includes a focus of attention and relaxation, suggestions for alteration in subjective experience for pain, hypnotic suggestion lasting at least 20 minutes. So the suggestion should be repeated at least 20 minutes. 4 to 7 sessions indicating brief hypnosis treatment, and 8 or more sessions to indicate hypnosis treatment and instruction in daily home practice of self-hypnosis, like every day. So one of the commitments I made to myself after reading this article was I just use it for every single chronic pain. It makes the results much more measurable when you make the treatment something standard. And conclusion, so the overall result was so promising, and the review indicates that hypnotic intervention for chronic pain results in significant reduction in perceived pain, and in some cases may be maintained for several months. And it's superior to some alternatives like physiotherapy, as you've seen in temporomandibular study. Yeah, that's pretty much it. Let's have a discussion about the article. Yeah.
Okay.
Oh, yeah.
Thank you.
You're welcome.
Thank you, your presentation.
It was just an icebreaker. So it was just. Let's bring this down. Yeah. Okay.
Perfect.
Do you have
Yeah.
any note? Any question?
Yeah, one question I
Sure.
would like to ask is, the article suggests that we should have a standardization for the hypnosis during the research, right?
Yeah.
Then should there be any standardization for like the control group when they have the CBT intervention? Should they also apply like outside a section at home, or standardize other control group? You have a lot of control. That means when you standardize the hypnosis, you have to standardize other elements, right? At the
Yeah,
same time.
absolutely.
Yeah.
Yeah.
So like this, there's a different kind of control group I can see. Like in the first, they compare with the expressive supportive group therapy, and then they have some relaxation, just relaxation, and then there's some other experiment. They have physical therapy, so there's a lot of variations, and So is it possible to standardize all these control groups in order to make a more standardized comparison between the independent or sorry, it's not independent, it's the experiment group and also the control group, how to standardize it? Because the more you control it, since it's hard to control.
Yeah, to be honest, 100% standardization is impossible. Because at the end of the day, it is the expertise of hypnotherapists. So even if you standardize the number of sessions, the duration of sessions, how can you standardize the expertise of hypnotherapists? So you can do your best just to make it as standardized as possible, but it's never 100%. As you mentioned, this one of the limitations mentioned on this review article is there is no placebo group control, and there is nothing, there is no group showing the expectations. So there is no placebo control group. So at least 3 arms should have been applied: 1 arm for hypnosis, 1 arm for control, and 1 arm for placebo. And sometimes, regarding CBT, there was a puzzling. It is on page. Let me find it. That's the one.
Yeah, 5 to 6, I think, right?
Yes, you're right. 5 to 6. There is a study, and it's comparing CBT, or cognitive behavior therapy, to hypnosis. The issue with this study was the technique, they call it CBT, is hypnosis. Let's take a look at the condition. They say, avoid using the pain label to describe their sensations. Reinterpret pain sensations as numbness through the use of imagery. So if it's like a hypnotic technique, hypnosis technique. So the issue with this article is they are mixing CBT and hypnosis. So you are not sure that which one is hypnosis and which one is CBT. They call it CBT, but in practice they are applying hypnosis. So they say, change the sensation of pain through imagination. This is a kind of hypnosis, even though you don't label it as hypnosis. That's the issue of this article.
Because there's many things are in common, like mindfulness is part of CBT, and it's quite similar to hypnosis. And so they are quite overlapping in some area, but still they're based on different model, right? So it's not totally the same, because CBT is focused on how the interaction between cognition, behavioral, and also your consequence, how to change your behavior, how to change your thoughts in order to improve your psychological well-being and also to have a better behavior. So it's quite different from hypnosis. It's technique, right? Is it a technique or is it a kind of treatment or include a lot of theory inside? So maybe we have to define the difference between these two approaches.
Yeah, that's the issue with this article. As you said, there is a lot of overlap between CBT and hypnosis. But having said that, all these criticisms are valid about this article, but we should still respect the result. The result says possibly a hypnotic induction may detract or decrease from some forms of CBT for chronic pain. So the group who were receiving CBT and the group were doing much better comparing to group who were receiving CBT plus hypnosis. So it's puzzling, it's questionable, but we still need to put a question mark beside CBT and hypnosis when they want to use them together. Another thing is, another issue with this article is they didn't choose just one chronic pain. They picked different chronic pains, and most of them were chronic back pains. So chronic back pain is very, very different from chronic mandibular pain or chronic muscle pain. We call all of them pain, but there are different entities. So one of the issues of this article was this. So we should be careful about combining CBT and hypnosis, but we need to be clear about the definition of CBT and the definition of hypnosis. Yeah.
So that means there's a negative effect on the combination use of CBT and the hypnotherapy together. Does it mean that?
Possibly on chronic pain,
Yeah.
but there is a huge question mark on this article. This article has a lot of.
So this article cannot explain why there's something there that reduces the effectiveness.
No,
of
it's just the
hypnosis.
statistics. Yeah, there is no mechanism, and there are just statistics, and there are some fundamental issues with the design of this study. But we still need to, and it's an old study, 1989. This is the puzzling study. So when they say at the end of this article, this review article, they say the result is amazing. It's the exact word is very promising, very promising. But they mentioned this article as a puzzling one, and
So there's no reason or maybe further research.
Yeah,
It's
they
needed
are
to clarify
recommending.
why this unclear area, a gray area for both
Yeah.
approaches.
Yeah.
Yeah, it's maybe when they use alone and when CBT use alone and hypnotherapy use alone, would there be any different?
But
Because there's combination for the use, right? One is with I should clarify the difference between the control group and also the experiment group is, let me see. So one group is CBT with hypnosis together, and one group is CBT only. Is it?
there is, yeah, I think that's the design. Yeah, there is. Let me. Chronic pain. Randomly assigned to CBT alone, CBT plus hypnosis, and attention control. The hypnosis and CBT treatment were identical, with the exception of a hypnotic induction. However, the CBT intervention used in this study included.
But there's no one comparison group like having the hypnosis only group.
No.
Yeah, I think
Yeah.
if they have this group, maybe we have a more comprehensive understand about why you CBT alone, but it's no hypnosis alone.
Yeah.
Yeah.
Back to your note about the overlaps, I saw something. There was, let me find it. It was, Jacobson relaxation. It was an article about arthritis, and it was talking about, it's on page 3, and it compares hypnosis versus Jacobson relaxation. And the result was they were both superior, they were great in results, but they were the same. I mean, the group with Jacobson relaxation and hypnosis, there was no statistical significant difference between them. But the thing is, when you read the technique, the Jacobson relaxation technique, it's really, really like a hypnosis induction. So it has all the elements in Jacobson relaxation. You need to they call it progressive relaxation. You need to contract and relax different muscles of your body. And there is an induction technique in hypnosis which is pretty much the same. You focus on different parts of your body and you just contract and relax the muscles. So they are very, very similar, and sometimes the issue of these articles are they are assumed to be different. The experiment group and the control group, they are assumed to be different. But you pick the overlapping areas and compare them, and it's obvious the result would be identical. That's another issue about the overlapping. And the standardization will solve this problem. If you define and standardize what do you really call Jacobson relaxation, what do you really call CBT, what do you really call hypnosis, it makes the measurements much more reliable.
Yeah, one thing I want to know more is, so what is the core principle of hypnotherapy? What's the core principle about hypnosis?
Yeah, that's another issue because there is no consensus about the definition of hypnosis.
So there's no consensus
No,
yet?
there are different schools of thoughts. There, for example, there is American Society of Clinical Hypnosis. They have a definition about hypnosis, and the American Society of Psychological Association or something. They have their own definition, and the Ericksonian school of thought have their own definition of hypnosis. But most of them are based on the fact that when there is concentration and focused attention and suggestibility, there is a hypnosis state. But there is no consensus about the definition of hypnosis and even the mechanism of hypnosis. Nobody
so
knows
there's
exactly.
no theories and no mechanism, it's just a tenet. Is it as a tenet, or it's something that more grounded in some area, or I'm not sure what it's about? I just watched from the movie, but I never tried any hypnosis experience, so I don't know what it is like.
Yeah,
but I think it's very magical, because I think it maybe individual difference may play the role too. Some people may just remain the same no matter what you do on them, right? They just remain themselves. They don't enter that suggestion or induction state, right? They don't have that hypnosis state. So what going to do with these people when they can't focus on that suggestion?
Yeah. Back to the first part of your notes, in terms of mechanism or the theory. There are a lot of theories about hypnosis, but there is no consensus about the theories. One of the theories which I really resonated the most was suggested by University of Calgary. They used to publish a journal. I don't know why they stopped publishing it, and the journal was Journal of Mind Body Regulation, I think. And they stopped publishing it. I don't know why. But one of the issues was allocated to the definition of hypnosis. And they define hypnosis as a metacognition game. And metacognition is a cognition about a cognition. For example, when you have a pinprick and you feel pain, it is a simple pain. It is a simple cognition. But sometimes you know you have pain. This knowing or this cognition about another cognition is a metacognition. Or another example is when you know someone but you don't remember the name. For example, a famous actress. You know that you know her, but you don't remember the name. So the name is a cognition. But the fact that you know the name is a metacognition. So you have the metacognition, but you don't have the cognition. And based on their model, based on their theory, hypnosis is a metacognition game. Hypnosis is playing with the metacognition, so the cognition is affected. So you change with the metacognitions of pain, for example, and the pain is affected. So when you have a pain, there is a simple sensory pain, but there is another component, and that component is the affective component. The pain goes up in your limbic system, in your cortex, and it's assigned with, and it is combined with your memories, your associations, with your childhood experiences, and a very sophisticated metacognition is created. Hypnosis is about playing with those metacognitions. That's one of the theories. It's a model which really I like because I think it describes a lot of phenomena in hypnosis, but it's not perfect. There are other interpretations as well. Yeah.
So there are a lot of approaches are very similar, like relaxation tenet and hypnosis tenet, and also like other like what to say, it's quite similar to each other, and it's the definition and also the construct of hypnosis not clear enough to be administered in research area, right? Doesn't mean that the construct, the term hypnosis is not clearly defined yet. So no matter how they compare with what's the effect, or what's the importance, or how does it important to compare? So what are the things that more important to compare with rather than compare to very similar area like relaxation and also CBT, they're so similar, right? So they're just comparing into their inner elements. Just this element belongs to them, and then it compares to just some element of them. And so I don't know how to say it. It's just comparing himself to himself in some sense.
Yeah. So your notice, if I understood correctly, the hypnosis is a subjective experience. It's not something objective. But clinical trials are about objective. So how we can make it objective enough to measure the results? The answer is the standardization. And it's not just about hypnosis. Let's focus on schizophrenia or histrionic trait or other psychology. How do we, DSM, right? DSM-4. When I was studying, it was DSM-5. I don't know. Is it DSM-5? I assume it's DSM-6 or something like that.
Yeah, it's around 2012 or 13 they changed it, upgraded it.
So I assume it's DSM-7, 6.
I guess not that far.
Anyways, DSM is a system of definition. There are some criteria. And it's not written on stone. Sometimes a psychologist or psychiatrist may say this one is a schizophrenia, but the other one says no, it's bipolar disorder. So there is no cutoff point. So it's not just about hypnosis. It's not just about the schizophrenia. It's about any subjective experience. These are social sciences, and then we want to measure social sciences and human experiences into a measurable experimental model. That's why we need to define or standardize at the beginning.
So what element in hypnosis make it hypnosis?
That's a good question. I would say the hypnotic phenomena. Like one of the hypnotic phenomena is catalepsy. Catalepsy is a muscular rigidity. So this can be a good indicator. So one way to design a study to say who is under hypnosis and who is, for example, under Jacobson relaxation is to add an indicator like catalepsy. If the patient is cataleptic, we can define him or her as someone under hypnosis. The other one is eye openness. Some people under hypnosis, they can't open their eyes. So maybe it's a good idea to ask them to open their eyes. If they can't, we can define them for that particular study as hypnosis. So there are different phenomena in hypnosis, like catalepsy, even in deep hypnosis, out-of-body experience, unity experience. There are a lot of hypnotic phenomena, and I think those hypnotic phenomena are a good indicator of labeling someone as being under hypnosis.
I see. So are there possible chance that people may not enter that hypnotic state, like they're still awake and they cannot just get into that state?
Based on the definition of American Society of Clinical Hypnosis, 5% of normal population are not hypnotizable at all.
Why?
20%, nobody knows, and it doesn't change over time. So with practice, meditation or something, it doesn't change the hypnotizability. 5% are not hypnotizable at all, 20% are highly hypnotizable, and the 75% are something in between. So back to your question, 5%. But this is based on the definition of American Society of Clinical Hypnosis. Based on the definition of Milton Erickson, the great hypnotherapist, 0% are not hypnotizable. Everyone is hypnotizable. But the definition of hypnosis is different, the techniques are different. But let's stick to American Society of Clinical Hypnosis. Based on the definition, 5% of normal population are not hypnotizable. The good thing is, for therapeutic purposes, there is no need for a very deep hypnosis. For like if you want to do self-exploration or like recreational hypnosis, maybe you need a deep hypnosis. But as you saw on one of the articles, for therapeutic uses, for example, for managing chronic pain, a moderate level of hypnosis is more than enough. So you can So even people who are not very hypnotizable, the hypnotizability is low, they can still benefit from hypnosis when it comes to medicine. Yeah. You're so quiet, Sherry.
My question is just more general. I would be curious to know, though it manages the chronic pain, without that pain, is it more advantageous to the healing structures for any of these ailments, or does it just mask the pain and the problem persists? So that would be where I would be curious on the benefits of the hypnosis for the chronic pain that ultimately affects the ailment. So
very wise question. To be honest, they discussed about this, and they said, actually, I think Johnson, most studies have focused on page 7. They said most studies have focused on how hypnotic suggestions may be used to achieve analgesic effect, but hypnosis may also have other benefits for chronic pain patients, such as reduced anxiety, improved sleep, and enhanced quality of life. And what they have forgotten is what you mentioned, the underlying cause or the structure. That's very important. Yeah, that's one of the issues with these studies. Most of studies about hypnosis and chronic pain, they are just focusing on pain itself, not the underlying cause, not the deformity the pain makes, or the anxiety component of pain, sleep, and quality of life. Yeah, very wise question.
because it would seem that a lot of times, I mean, if we're speaking about hypnosis in a sense of, you know, mind over matter, that if we can control that element of the effect of pain, then can it go even further to actually control our matter and what is happening within us? So beyond the pain, to actually heal.
Yeah, that's a great note. To be honest, the assumption of conventional medicine most of the time is to mask the pain. But if we go to more holistic approaches, for example, a couple of days ago I was talking to a lady, she was a Bowen therapist, and she was talking about pain as a message. So she was talking about and the concept was really interesting to me. She was telling me maybe the approach is not just to mask the pain with hypnosis or whatever. Other than that, we can communicate with the pain. Maybe there is a message in the pain, and we need to interpret that message, and we see what's going on. Even when it comes to chronic pain, maybe it's a good idea to listen to pain, understand the message, and interpret that.
Right, so that it ultimately is a healing process.
Yeah, healing process and having a holistic approach rather than just using hypnosis as another painkiller.
Right.
Because
like a Tylenol.
Yeah, that's the best case
Beyond
scenario.
that.
Yeah, that's a good. And the best approach is being holistic. Let's see what does the pain is telling us.
Because my sense is that medical hypnosis is ultimately for that. It's for a more holistic approach to healing, to reducing pain, which ultimately, as this says, enhanced quality of life, which includes health.
Yeah, that's so true.
I also was curious to know a little bit more about some of the effects for the for arthritis.
Yeah.
So I know that they made this study, but the osteoarthritis, did they ever do anything, or did I miss it, with scoliosis arthritis? Do you know?
No, I don't think so.
Okay.
Yeah, maybe something recently, because this article is not very new. It's this article is published in 2007. It's very comprehensive,
Yes.
but yeah, that's a good question. Did you say sclerosis or scoliosis?
Scoliosis.
Oh, okay, yeah. I haven't seen, but there should be something about that. Even for arthritis, the number of studies are very limited. I don't know why.
Because that is one that is very, I think that would be one that would be clearly more about reducing the pain, because it's in the joints, and if you reduce it's like, I think it's from like the inflammation in the joints, I believe.
Mhm.
And if you reduce the pain, I think that you would be able to perhaps be more mobile with your joints, which then in turn may somehow reduce that inflammation.
Mhm.
If it's not just sort of stuck there with the swelling, if you could sort of, loosen it somehow with mobility,
Yeah.
which ultimately, if you don't feel pain, you're more prone to be able to do it.
Yeah.
Free, yeah.
More free, correct. So that was the other thing. And then I know also for the jaw, I'm particularly interested in that, because I'm particularly interested in medical hypnosis for dentists.
Yeah, that's
So-
so true.
That I found very interesting, and I think that that's something that they should explore more for sure. I think there should be more studies on that.
Yeah.
And that-
And the results are amazing for
Mhm.
temporomandibular joint, TM joint. The results are really great. So, yeah. So they are much better even than occlusal appliances. And I don't know
Yeah.
why, to be honest, a lot of these modalities are covered by insurance while they are inferior to hypnosis. Hypnosis is superior to some of them, like occlusal appliances
Right.
or sometimes physiotherapy. I'm not against physiotherapy,
Mhm,
but
mhm.
evidence-based medicine shows that in some cases it's superior to hypnosis is superior to physiotherapy. So my question is why physiotherapy is covered by insurance companies, but hypnosis is not. So
It's not ever.
no, just very very few insurance companies in like veterans or I think police officers, but
Okay.
normal extended health companies, they don't cover insurance hypnosis.
Is it something that you can add on as a component to your insurance, like an additional package? Is it even in the offering?
No, unfortunately not.
Hmm.
To be honest, the underlying cause is not the underlying issue is not insurance companies. The underlying issue is CRA or Canada Revenue Agency, because you cannot write off, or I'm not talking about tax here, but you
Right,
cannot
right.
write off the expenses you spend on hypnosis as your treatment budget. That's why insurance companies cannot offer that as an insurance product.
So like massage treatments, there are some that are allowed to be
Mhm.
written off if they're done by like somebody who's in the medical field,
Right.
who has certification. So even with hypnotists that have that medical kind of certification, there is no offering.
No, to my
Can be
knowledge,
covered?
no. To my knowledge, there is no, and I don't know why. Because
Hmm.
there is, if CRA and insurance companies are focusing on evidence, this is the evidence. But it looks like they are more focusing on lobbies. I don't want to talk about
No,
politics
but
here.
maybe
but-
it's coming. Maybe
Yeah,
it will
maybe,
come,
I
and then
hope.
maybe it will be advantageous, and people will take more advantage of it.
Yeah, maybe someone hears this conversation and say, "Oh, let's add hypnosis."
Correct.
Mm.
Is it more time consuming to receive hypnotherapy than physical therapy?
No, actually, no. Actually, there is a book called Hypnotherapy, and the writer is Dave Ellman. And Dave Ellman was just working with dentists and physicians. Most of his clients were dentists, and he was saying, if you cannot use hypnosis in 10 seconds, then hypnosis has no value for a dentist, because dentists they don't have time.
Mm-hmm.
So his focus was to use hypnosis in 10 seconds. So back to your question, no, it's not time consuming. You can, the more time you have, the more effective, and you have more flexibility to have maneuvers. But no, even in 10 seconds you can benefit from hypnosis. So it's not a matter of time. I don't know.
It's a matter of money, or it's more expensive for hypnosis?
I think it's a matter of awareness, because nobody knows it's evidence-based, and it's Hollywood's fault.
Yeah, it's more mysterious. I'm thinking, it's like magic, right?
Yeah.
After you do this, you change suddenly.
Yeah. And that's the mission and that's the ultimate goal of this session, just to talk about the evidences behind hypnotherapy and bring evidence-based hypnotherapy on the table rather than mystical, fictional, Hollywood-driven
Is this
understanding of hypnosis.
hypnotherapy similar to Freudian approach, the Sigmund Freud? I mean,
There are some overlaps.
Yeah, are there any common
Free association,
or is
you
they the same? And he also did some hypnosis, right, in his psychoanalysis treatment, right? So are they the same?
There are huge overlaps between free association and hypnosis. And if you read Freud's history, he was using hypnosis for a while, and then he mentioned something happened. I don't remember exactly what happened. And then he decided to switch into free association. But free association is very, very like hypnosis.
Yeah, whatever you come to your mind, that's it.
Yeah.
Freudianly, so you make analysis of it. But are there any interpretation or analysis for anything you think of in your mind for hypnosis?
Yeah, actually hypnosis is like a platform. So it's not a therapy itself, it's a platform for other therapies. So you can use hypnosis, and on top of that you can use psychoanalysis, even cognitive behavioral therapy on top of hypnosis. So you can use CBT or psychotherapy in normal conditions, or at a desk in a conversational mode, or under hypnosis. What's the difference? Under hypnosis, the patient is more receptive to suggestions. So it's like magnifying the effects of psychoanalysis or psychotherapy. And back to a note about Freud. I was reading a book about Carl Gustav Jung, and you know
Carl
Jung?
Jung?
Yeah, Carl Jung.
Jung
And
is another approach.
Yeah, and
right?
he was
Psychoanalysis,
one of the friends of Freud, and I think they were working together from 1905, and then their ways were divided in 1917. I'm not sure, but after 10 years they were divided. And I was reading a book, and this book, the name of the book was Jung. It was written by Archetype is what Jung says. The name of the book, the editor was Joseph Campbell, and he was mentioning Jung was using hypnosis a lot in medical schools. Yeah, so maybe next time I bring the exact use of hypnosis and how Jung was using hypnosis in medical school, because he was a psychiatrist. Yeah. Yeah, back to your question, free association has a lot of similarities with...
Yeah, there's a lot of similar area I think you can see. So what's the basic concept that become a unique feature for hypnosis in comparison to many similar approaches?
Mm-hmm. Oh, you're looking for a benchmark?
Yeah, so they're so similar, right? So I'm just thinking whether are there any unique feature that's for hypnotherapy, but they can be found in other approaches.
American Society of Clinical Hypnosis suggests 3 benchmarks. One of them is attention, focused attention. The other one is suggestibility. And the third one is dissociation.
Free association.
Dissociation.
Dissociation.
Yeah.
What
Someone is
dissociation?
dissociation means being dissociated from the environment. So under hypnosis, some people experience different levels of dissociation. Some people are just distracted from the environment. Some people don't hear anything or don't see anything, and some people experience deep dissociation, like out-of-body experience, or like even hallucination. So these three components is a great benchmark to define someone being in a hypnosis state. Focused attention, suggestibility, and dissociation. So these three elements are crucial.
I see.
Yeah. Maybe we can use them as a benchmark. If someone is dissociated from the environment, their attention is focused, they have selective thinking, and they are suggestible. So for example, we had an event a couple of days ago, and someone was hypnotized. And some people approached me and said, is he sleeping or he is under hypnosis? I said, let's try, I don't know, let's try. And I made a suggestion. Okay, now you're slowly elevating your hand. And while he was like sleeping, he elevated his hands. So I knew that he was not sleeping. It was hypnosis. So suggestibility, dissociation, and focused attention, or selective thinking, based on what Dave Ellman says.
So they can shift their focus and attention very easily, right? Is it like that? So they can focus on one point and then they can choose, or they can have a willpower to choose to focus on one point to the another point, right? It's similar thing.
Yeah, it's
Easy
I would
to
say
control.
selective attention, because Dave Ellman says, because I follow Dave Ellman's school of thought, he says selective attention. For example, right now you are under the impression of a lot of signals coming, like the signals from the table on your hand, the signals from your food, the signal from the sound from the environment. But you choose intentionally to focus on what I'm saying or what Sherry is saying. But you are not focusing on the air conditioning sound. You still hear that, but you just exclude that.
Yeah, you can choose to exclude other things and focus on one thing you want to focus.
Yeah.
So you can control your focus very easily.
Yeah, that's why in one of the articles, I don't remember which one, the mechanism of hypnosis, the way they applied hypnosis was to filter out the pain. They had an imagination that when there is a chronic pain, there are different sensations, and these sensations are competing, and they were imagining they are filtering out the hurt or the pain sensation. So they were specifically trying to use this selective thinking.
But they also have the mental visualization for some imaging, the positive images in their mind, right? So in order to escape the painful environment and other stimuli, right?
Yeah. Okay, perfect. I think because we can just today have one part of conversation, and then we listen to Sherry's presentation, and then we can wrap up the first session.
Sure.
And are you ready?
On to mine?
Yeah.
Yes, I'm
So
ready.
let's see.
I'm okay sitting here if you want to just start it.
Okay, so you want me to change the slides?
Sure.
Okay, sure. Let's me.
If we're completely ready
More
for
than
that.
happy to do that. I can make it larger like this. And then over here. Okay. I'm just waiting for.
The leg to catch up?
Yeah, it's
No
okay.
problem.
Is it good? The size of the slide?
Yes, that's perfect.
Okay.
It's perfect. So, thank you, Reza, very much. This was very interesting. I look forward to more. I'm also very pleased to be part of this journal club that educates people on what I believe is going to be something so powerful in the future. And I am an owner of Luxury Corporate Cruises, and on the note of being pleased to sort of pioneer this into the future, this concept of medical hypnosis, I am doing this medical hypnosis cruise where Riza will come on board and he will educate people. He will present a course. He will do some hands-on hypnosis or some kind of workshop presentations that will engage people in depth about the actual, experiences. And so this cruise that we're promoting right now is going to be sailing on October 30th, as you can see in the slide. It is going to be going 7 nights from Rome to Barcelona. We will be hitting destinations and ports of call such as Monaco, Florence. We'll be hitting a lot of really popular places in Europe, and we'll be able to take some of this program possibly into the ports of call and make it sort of more interactive that way. It's very, very exciting that we're able to do this. Riz's course will be, of course, front and center. We'll be having some private sessions, perhaps in the wellness spa, and the ship is very, very well established for these types of activities that we'll be doing. And the cruise itself will have a one price standard set, and your companions will be able to join you complimentary. So it's for people in the medical field, something that they can perhaps utilize and have as a win-win. They'll benefit, we'll have an education component, and it'll also be fun and a travel vacation component. So for the next screen, I'm just going to say that in keeping with some of the discussion, medical hypnosis helps us alter our emotional and physical states to alleviate, as we've discussed here, chronic pain is a potential physical state alteration, and it's done through our mental capacity. And so Luxury Corporate Cruises is offering this cruise associated with hypnosis, and I thought that I would just take you a little bit away into your thoughts and share with you some of the thoughts of the sea. So the next screen brings us to a little video that I'll play to tell you a little bit more about what Luxury Corporate Cruises does and why I feel it's important to do this medical hypnosis cruise. So that basically is our concept. We do these customized cruises that have a myriad of advantages. And the next screen is just really, there is a reason why we get vacation, you get work, and you get win-win for everybody. You get to get and the last screen I have for you is really just a snippet of a video that teases you to actually see exactly what this particular cruise line is offering. We are having it on Oceania Cruise Line, so I will play that for you now, and you'll see some of all the luxurious ways you can relax, rejuvenate, and at the same time bond and network with other colleagues that are interested in hypnosis.
Milestones are meant to be celebrated.
Milestones are meant to be celebrated.
We invite you to celebrate our latest milestone.
We invite you to
Aboard
celebrate our
Sirena,
latest milestone.
the newest addition
Aboard
to the Oceania
Sirena,
Cruises fleet of
The newest
intimately
addition to the
luxurious
Oceania
ships.
Cruises fleet of intimately luxurious ships.
Sirena's elegantly designed interiors personify
Sirena's
the O-Life
elegantly designed
experience.
interiors personify the
Sophisticated.
O-Life experience.
Intimate,
Sophisticated.
classic.
Intimate. Classic.
With just 684 guests, life aboard
With just
Sirena is both
684
relaxed
guests,
and
Life aboard
rejuvenating,
Sirena is both
inviting you
relaxed
to
and
discover your
rejuvenating.
perfect cruise
Inviting
vacation.
you to discover
Each
your
new day,
perfect cruise
it's
vacation.
your world,
Each
your
new
way.
day, it's your world, your way.
Aboard Sirena, the world-renowned Oceania
Aboard
Cruises
Sirena,
culinary program
the
has been
world-renowned
elevated yet
Oceania
again.
Cruises culinary
Be
program
among
has
the
been
first to
elevated yet
experience
again.
Tuscan steak,
Be among the
a
first
fresh
to
take on the
experience
classic
Tuscan
American
steak,
steakhouse with a
fresh take
distinctly
on the
Italian
classic
twist.
American steakhouse with a
Savor
distinctly
the
Italian
vibrant
twist.
flavors of Southeast Asia and beyond
Savor the
at the
vibrant
stunningly
flavors of
beautiful
Southeast Asia
Red
and
Ginger,
beyond at the
an
stunningly
Oceania Cruises
beautiful
guest
Red
favorite on
Ginger.
board Marina
An
and
Oceania
Riviera.
Cruises guest favorite on board
The Grand
Marina
Dining
and
Room
Riviera.
offers elegant service throughout the
The
day,
Grand Dining Room
with a
offers
surprise
elegant
transformation
service
into
throughout
an
the day.
authentic French
With a
bistro at
surprise
lunchtime.
transformation into an
Jacques'
authentic French
Bistro
bistro at
is inspired
lunchtime.
by the family recipes
Jacques'
of
Bistro
Master Chef
is
Jacques
inspired by the
Pepin,
family
our
recipes
executive
of Master
culinary
Chef
director.
Jacques Pepin, our executive
Whatever you
culinary
choose,
director.
Oceania Cruises offers the
Whatever you
finest
choose,
cuisine at sea.
Oceania Cruises offers the finest cuisine at sea.
Your Epicurean explorations continue ashore.
Your Epicurean
Thanks to more
explorations
overnight
continue
stays
ashore.
and longer port
Thanks to more
stays
overnight stays
in a range of boutique
and longer
ports of
port
call
stays
and
in a range
picturesque
of boutique
out-of-the-way
ports of call
harbors.
and picturesque out-of-the-way harbors.
As captivating shorelines fade into the horizon,
As captivating
Sirena's
shorelines
exquisitely
fade into the
appointed
horizon,
suites and staterooms
Sirena's
offer a
exquisitely
relaxing
appointed
sanctuary.
suites and staterooms offer a
World-class
relaxing
amenities,
sanctuary.
fine linens, and the
World-class
luxury of our
amenities,
exclusive
fine
Prestige
linens,
Tranquility
and the luxury
beds
of our
rival the
exclusive
lavish
Prestige
comforts found in the
Tranquility
world's
beds
finest
rival the
hotels.
lavish comforts found in
Wake
the
up to
world's
sweeping
finest
ocean
hotels.
views and quiet
Wake up to
rejuvenation
sweeping
at the
ocean
famed
views
Canyon
and
Ranch Spa
quiet
Club,
rejuvenation
an
at the
oasis
famed
of
Canyon
unique
Ranch
health and
Spa
well-being
Club,
treatments.
an oasis of unique health and well-being
Wherever
treatments.
your explorations take you during Sirena's
Wherever
inaugural
your
year, the
explorations take
radiant
you during
Italian
Sirena's
Riviera,
inaugural
or Spain's
year,
Costa
the
del
radiant
Sol,
Italian
the magical
Riviera, or
islands of
Spain's
French
Costa del
Polynesia,
Sol,
or even lands
the
down
magical
under.
islands of French Polynesia,
Each
or
journey
even
aboard
lands down
Sirena
under.
combines luxury,
Each journey
comfort,
aboard
and
Sirena
the world's most
combines
sought-after
luxury,
destinations.
comfort, and the world's most sought-after destinations.
Join us as we celebrate Sirena's
Join us
unforgettable
as we
inaugural
celebrate
season.
Sirena's unforgettable inaugural season.
So again, we invite everybody on the medical hypnosis cruise to join Riza and learn so much more about all of the stuff he has to share.
Okay. Thank you, Sherry. And
Thank you as well.
welcome, Fatma. Sorry, I have to apologize. I think you were behind the closer, right?
Oh well, I was actually lost
Oh, okay.
because I didn't know which room is this. And
Oh, really?
oh yeah.
Oh, sorry.
Yeah.
Okay, my bad. Sorry.
Yeah.
And we were about, because it's broadcasting through Facebook Live, and we were about to wrap up the session after the sponsor presentation. But because you are here, we just continue a little bit about chronic pain. Because Fatma used to be a pediatrician,
Oh.
and now she's working with elderly people. So she has tons of experience in children, in adults, and in geriatric part of pain and chronic pain. And this article was about how to apply hypnosis for chronic pain in different conditions like cancer patients, because 75% of people with advanced cancer are suffering from persistent pain, low back pain, arthritis pain, sickle cell disease, because vaso-occlusive pains are quite
Yeah.
common.
Yeah.
I'm talking to who? And temporomandibular pain and fibromyalgia, disability-related pain, mixed chronic pain problems, and there was a discussion in terms of how effective hypnosis is. So do you have any particular experience about chronic pains for these conditions?
No, it's just like I was reading through the sickle cell anemia pain, right?
Yeah.
So I realized that actually the study is in 1997, which is
Old.
old,
That's so true.
right? And only 37, patients were enrolled, right?
Yeah.
So have there been any updated studies, like new studies, and
It
maybe
should be.
bigger number?
Yeah, it should be. To be honest, I chose this article, and this article is old. This review article is published in 2007. The reason I chose this article was, first of all, it was so comprehensive in chronic pain, and the other factor was it was free, And I could purchase an article that was not a big deal, but I was not sure about the copyright issues. If I purchase that, can I distribute that to my audience or not? That's one of the reasons I selected this article, which is old. So
Yeah.
that's one of the weak points of our journal club, and I have to do something about it. I have to purchase new articles or have access to databases and understand what I can do about the copyright issue. Can I print it out and give to the audience, or it's against copyright? Maybe you can help me in that regard. Back to your question, yeah, it is old. The review article is old, and this article is old as well. There should be new findings about sickle cell anemia, sickle cell pains.
Yeah, but usually the abstract is free. Usually
Yeah, the abstracts are free.
And maybe abstract is enough.
Yeah, that's
This looks
that's
like an abstract, actually.
Yeah, because it's a review article, every
Yeah.
part is like an abstract.
Yeah,
But
exactly.
this one is a full article. It's not an abstract. But
This-
because
this
it's
one, this
yeah,
small one.
no, just the article.
Oh, the whole.
It's a review article.
Yes,
Yeah, the
yes,
discussions.
yes. Oh,
Yeah.
To
Okay.
see how.
But I mean, yeah, of course, when it is new, it's
Yeah,
better. And maybe they based their studies, recent studies,
Yeah.
on old studies, because here temporomandibular is in the year 2000, then 2002.
yeah,
These are really
right.
considered old in the medical
Yeah.
field, right?
That's my homework for next session.
Yeah.
Look for
1983
New
for
articles.
cancer pain. I think it will be very beneficial
yeah,
if you find new articles.
Sure.
And abstracts are always free,
yeah,
and you can share it, no problem.
yeah. That's
Well,
a
they
good.
are
That's a good
always
alternative, just to
Yeah.
talk about abstracts rather than
Yeah.
full articles, because they are free and
Yeah, exactly.
yeah.
But I think it's a good starting point to have a very comprehensive one to start with. Yeah.
Oh yeah,
Yeah.
certainly, yeah.
And in sickle cell anemia and associated pains,
there was a significant reduction in the number of pain days. But there was no effect on bad sleep nights. People with sickle cell anemia have a lot of sleep disturbances.
Yeah.
It was not getting better, but at least the number of pain days was decreased.
Which is actually, pain is really bad in sickle cell anemia. I hope that next time you find updated articles. The more updated publications, it will either confirm these kind of findings, or maybe something else.
Yeah, absolutely.
Right?
Yeah.
Because the most recent research is always supportive of previous research.
Yeah. They are more comprehensive.
Yeah.
And do you have any idea or suggestion about the next topic? Are we gonna go through the chronic pain, or PTSD, or psychological? Do you have any suggestion?
I think PTSD is now it's a big topic.
Yeah.
Of military in particular, right?
Yeah. And it's my area of expertise, kind of. So yeah, maybe our next journal club discuss about PTSD. It's an interesting topic.
You know what I suggest?
Yeah.
You try to approach the RCMP and try to approach the Veteran Affairs and invite some, one person from them to attend the club.
That's a good idea. Yeah.
Because they have many cases, and maybe when they come and you will have updated articles, publications,
Yeah. I'm
They
gonna
may
do
be
that.
interested in actually maybe you guys doing a presentation, in their club or wherever.
Yeah. Maybe they become our sponsor, provide us with a place.
Yeah, exactly.
Yeah, okay, so thank you so much for your time, everybody. And it looks like our next session next month, or maybe the month after, would be PTSD, and we invite someone from RCMP. Okay,
Sounds good.
thank you so
Thank
much.
you.
Any question, any comments?
Veteran Affairs.
Veteran Affairs on RCMP. Okay,
Yeah.
thank you so much.
Thank you.
Thank you.
Okay.